And osteoarthritis or hand OA is a common condition that affects millions of people, especially those over 50. It causes joint pain, stiffness, and reduced hand function, which can make daily tasks challenging and impact independence and confidence. While it's more common in women, particularly after menopause, anyone can be affected. Many people think OA is just a part of aging or something that can't be treated, but that's not true. Recent research and clinical experience show that hand OA is not inevitable and there are many ways to manage it. Understanding the natural history of hand OA is important. The disease often progresses through phases, from inflammation and pain to periods of repair, and eventually less pain but more stiffness. Knowing this helps set realistic expectations and empowers people to take an active role in their care. In this video, we'll explore the latest advances in practical management and how a person-centered approach can make a real difference. When it comes to managing hand OA, non-drug approaches are the foundation. Education is key. Understanding the condition and knowing that progression isn't always inevitable can be reassuring. Hand exercises such as stretching and strengthening routines have been shown to help reduce pain and improve function. Splinting can provide support, especially for the base of the thumb or painful finger joints, and activity modification helps reduce strain on affected joints. It's important to remember that these strategies are not about avoiding hand use, but about using the hands in smarter, less stressful ways. Weight management and general physical activity also play a role, even for hand OA, by reducing systemic inflammation. Clinicians recommend a multimodal approach combining education, exercise, splinting, and lifestyle changes tailored to each person's needs. This person-centered care, supported by positive and accurate information, can transform the experience of living with hand OA. Non-drug strategies aren't enough. Medications can help manage symptoms. Topical NSAIDs, such as anti-inflammatory gels, are recommended as the first pharmacological option and are especially useful for localized pain. Oral medications or steroid injections may be considered for more severe or persistent symptoms, but they are not the first step. It's important to use the lowest effective dose and monitor for side effects. Surgery is reserved for cases where other treatments have failed and symptoms are severe. Procedures like joint fusion or trapeziectomy can relieve pain and improve function, but they come with risks and are tailored to individual needs. Throughout the treatment journey, regular communication with healthcare providers is crucial. Addressing concerns, busting myths, and using positive language can help people feel more in control and hopeful. While there's currently no cure for hand OA, ongoing research is focused on new therapies that may one day slow or prevent the disease. And OA remains an area with many unanswered questions, but the outlook is improving. New research is exploring genetic factors, hormone influences, and innovative drug targets that could lead to better treatments in the future. In the meantime, the best approach is to use the knowledge and therapies we have, combining education, exercise, lifestyle changes, and appropriate medications to improve quality of life. Empowering people with accurate information and supportive consultations can make a significant difference. Remember, hand OA is not just a normal part of aging, and there is always something that can be done to help. By staying informed and working closely with healthcare providers, people with hand OA can take charge of their health and look forward to new advances on the horizon.